हेलो फ्रेंड्स। नाउ जो आज का टॉपिक है मेनली क्लिनिकल हिस्ट्री क्वेश्चंस, जो सेपरेटली 2 से 3 शॉर्ट नोट्स आती है, जो ओनली क्वेश्चंस बेस्ड ऑन द क्लिनिकल एस्पेक्ट्स। ओके, और जो क्लिनिकल एनाटॉमी है उसी के बारे में जो क्वेश्चंस पूछते, उस हिसाब से ब्रैकियल प्लेक्सस इज़ वेरी इंपॉर्टेंट टॉपिक। इस पे 2 क्वेश्चंस कॉमनली फ्रेम हो सकते हैं, दोनों देखेंगे। तो 2 क्वेश्चन, एक अर्स पैरालिसिस पे आएगा और दूसरा क्रमकेस पैरालिसिस पे आ सकता है। तो ये क्वेश्चन किस तरह से फ्रेम किए जाते हैं, एक लॉन्ग हिस्ट्री, नॉर्मली इस क्वेश्चंस में एक हिस्ट्री दी जाती है कि सो एंड सो दिस एजेड पेशेंट कम टू योर ओपीडी हॉस्पिटल एंड इज अराइविंग दिस एंड दिस काइंड ऑफ साइंस सिम्टम्स, पेशेंट की हिस्ट्री, what is the kind of injury or the how the injuries occurred, and then you have to write what is the probable diagnosis or the what is the clinical condition, what is the basis, anatomical basis of these conditions, and how this condition is related to the anatomy. The questions are asked. Okay, now we will specifically see on the earth paralysis how the clinical history question is asked. तो नॉर्मली आपको हिस्ट्री इस तरह से क्वेश्चन में आएगा, देर इज़ वन स्मॉल 1 or 2 year baby that is presented to the pediatric OPD, and pediatrician found that there is a weakness in the both upper limb since birth. And on the history, the pediatrician revealed the baby was full-term born and having a assisted vaginal delivery. That is important, assisted vaginal delivery using a forceps. On physical examination, pediatrician found the baby's arms are medially rotated, adducted, and the forearms are the extended and the pronated. Okay, and there is also sensory loss over the lateral aspect of the arm. Okay, that this or there is one 35 to 40 years of the age person comes to the orthopedic OPD, and he has a history of fall on his shoulder during a bike accident, and because of the fall on the shoulder there occurs post trauma, there occurs the paralysis of upper limb. The position of the upper limb is at arm are the adducted, then extension at the elbow joint, pronation at the forearm. Okay, and the arm whole upper limb is medially rotated, and there is also lead to the sensory loss over the lateral aspect of the arm. Like these 2 conditions are asked in the question, and history is given, and below that the question is, first mainly questions is identify what is that clinical condition. Okay, so what is that clinical condition? The on the history of the fall or the injury during the birth, the arms are medially rotated and adducted, and the forearm is extended and pronated. It suggests a called as a Erb's पैरालिसिस. तो हमको ये देखना है कि वो क्लिनिकल कंडीशन में जो हिस्ट्री दिया था उसमें क्या है, अर्ब्स पैरालिसिस. ओके, देन वेयर इज द लीजन? सेकंड क्वेश्चन, इट इज लीजन इज एट द अपर ट्रंक ऑफ ब्रैकियल प्लेक्सस और अर्ब्स पॉइंट. ओके, that is the site of the lesion. What is the cause which lead to the or mechanism of injury that produce this condition? Undue stretching or injury at the upper trunk of brachial plexus, in which there is a increased angle between the shoulder and the neck, and that will lead to the excessive increase in the angle between the neck and shoulder and will lead to the injury to the brachial plexus. In case of birth injury, especially assisted vaginal delivery using a forceps, where is the head is the deliver and the shoulder is tucked below the pubic bone, and that will lead to the forceful forceps vaginal delivery, lead to the injury to the neck or stretching of the brachial plexus in the neck and that will lead to the injury. Okay, that is the main mechanism of injury. Okay, then the next question, what is the anatomical basis of the deformity? So the deformity क्या थी? One is the adduction, क्या था? Adduction, then medial rotation of the arm, then extension of the forearm, pronation of the forearm, and the sensory loss over the lateral aspect of the arm. Why it is adducted? Because there is a loss of or paralysis of the abductor, which is abductor deltoid muscle, that get paralysis. And what happens, antagonist muscle जो adductor करते, they will overact. The pectoralis major, teres major, and latissimus dorsi, these muscles are get overact, and paralysis of abductor, that will lead to the adduction. There is a medial rotation of the arm because of the paralysis of the which muscles, infraspinatus and the teres minor muscle, and which will lead to the overaction of subscapularis and pectoralis major. Okay, that will lead to the overaction. There is extension at the elbow joint because of the paralysis of the flexor muscles, mainly the bicep and the brachialis, and overaction of which muscle, tricep, an opposite overaction. There is a pronation of the, so loss of supinator muscle and the bicep muscle, and overaction of the pronator teres. Okay, sensory loss because of the involvement of the C6 segment that supplies the lateral aspect of the arm. That is what the anatomical basis of the deformity. Okay, sometimes directly theoretically question is asked, tell me the branches of lateral cord, medial cord, or the posterior cord. Okay, like this, what is brachial plexus, write note on how the brachial plexus is formed, or draw the diagram of brachial plexus formation, like this question is asked, that we covered in the last video. Okay, which type of nerve injury occurred? There occur neuropraxia. There is no nerve cut, because of the stretching there is a injury to the nerve, and that condition is called as a neuropraxia. Okay, so like this question is asked on the clinical history question. ये कंपलसरी क्वेश्चन आता है यूनिवर्सिटी एग्जाम में, और ब्रैकियल प्लेक्सस पे तो मोस्ट कॉमनली एक्सपेक्टेड क्वेश्चन है. ओके, अब सेकंड जो क्वेश्चन पूछा जाता है इस पे, तो वो आता है ऑन द क्लम्प-केज पैरालिसिस. तो उसमें क्या क्वेश्चन आता है? सो नेमली मिडल एज 50 or 60 year age of male or female goes to the orthopedic OPD and having a main complaint, inability to close his fist. So he is not able to make the fist, and there is a history of fall on outstretched hand. ये लिखा आता है outstretched hand, इस पे फोकस करना है, which result in the hyper abduction of the arm. Okay, तो outstretched hand. And what is that deformity form? Hyper extension at wrist joint and metacarpophalangeal joint, and the flexion at interphalangeal joint. And also there is a atrophy of the muscles of hand. ये उसकी फाइंडिंग्स है ऑर्थोपेडिक सर्जन की, क्या क्या उस पेशेंट को हुआ है. अकॉर्डिंग टू दैट द क्वेश्चन, फर्स्ट आइडेंटिफाई द क्लिनिकल कंडीशन. तो आप इसको इमेजिन करोगे, हाइपर एक्सटेंशन एट द रिस्ट एंड मेटाकार्पोफैलेंजियल एंड फ्लेक्शन विल लीड टू द क्लॉ हैंड. So what is that clinical condition? Claw hand formation is there, so that clinical condition is called as clump-case paralysis due to injury to the lower trunk of brachial plexus. What is the mechanical the mechanism behind the injury. Patient fall on outstretched hand, that will lead to the hyperabduction at the shoulder joint, and that will lead to the injury to the lower trunk of the brachial plexus. And mainly which nerves are involved? C8 and T1 segment along with the C7. Okay, these are get involved. Okay, so mainly C8 and T1 along with the C7. Okay, that is, so उसमें which nerves are commonly get involved? Is the medial root of median nerve plus ulnar nerve commonly get involved. These two nerves mainly supplies to the muscles of hand. So intrinsic muscles of hand get paralyzed, and that will lead to the condition called as a claw hand. So what is a claw hand? Patient is having a hyper extension at the wrist and the metacarpophalangeal joint and flexion at the interphalangeal joint, that is called as the claw hand. What is anatomical basis of this claw hand? There is extension at wrist, and okay, so why this extension? Due to paralysis of the long flexors of the forearm. Okay, that is mainly supplied by median and ulnar nerve, and opposite action of the extensor muscles of the wrist hand lead to the hyperextension. There is also hyperextension at metacarpophalangeal joint, mainly because of the paralysis of lumbrical muscle and the interossei muscle. This will get to the paralysis. Okay, these are supplied by median and ulnar. So there is a flexion at interphalangeal joint due to paralysis of lumbricals and interossei. These muscles get involved, that is how there is a flexion at interphalangeal joint. Atrophy of the muscles of the hand, because intrinsic muscles of hand are supplied by median and ulnar nerve. ओके, फिर डायरेक्ट क्वेश्चन आएगा व्हाट इज हॉर्नर सिंड्रोम, ये भी लिखा आएगा. हॉर्नर सिंड्रोम इज द इन केस ऑफ क्लम्पकेस पैरालिसिस देर इज इंजरी टू द T1 segment of the spinal cord, and that will carry the sympathetic innervation, and that will also get paralyzed, or that is also get hampered, which will lead to the Horner syndrome. What are the signs of Horner syndrome? ये आपको याद रखना है. पैमेला, there is a ptosis, that means drooping of the upper eyelid. Which muscle get a superior levator palpebrae superior muscle get involved. There is leads to the meiosis, that is means constriction of the pupil due to the paralysis of dilator pupillae. Anhidrosis means diminished sweat production over the face. Okay, that is involvement of pseudomotor and vasoconstrictor fibers. Then there is a anophthalmos, that means eyeball goes posteriorly, sinking of the eyeball, that is paralysis of the eye muscle or orbitalis muscle. And loss of ciliospinal lippus, when you pinch the skin over the back, there occurs the dilatation of pupil, that is also get affected. Okay, so this Horner's syndrome and its basis you have to write. Okay, तो हमने देखा कौन सी नर्व्स इन्वॉल्व होती है, हॉर्नर सिंड्रोम, एनाटॉमिकल बेसिस ऑफ द क्लॉ हैंड, एंड व्हाट दैट कंडीशन इज कॉल्ड. Okay, and additionally directly questions on the brachial plexus, branches of the cords, branches of the root, branches of the trunk, root values of the nerves coming from the lateral cord, medial cord, like these questions are asked. Okay, so these are the two important clinical questions asked over the brachial plexus. तो हमने देखा कैसे क्लिनिकल हिस्ट्री पूछी जाती है और उस पर किस तरह का क्वेश्चन फ्रेम होके वहाँ पे नीचे कौन कौन से क्वेश्चन दिए जाते हैं एंड हाउ यू हैव टू आंसर दिस क्वेश्चंस. ओके, सो दिस इज़ वेरी इंपॉर्टेंट फ्रॉम योर एग्जाम पॉइंट ऑफ व्यू. यूनिवर्सिटी एग्जाम में हमेशा इस पे क्वेश्चन आता है.